First question I want to start with was brought to my attention by a frontline healthcare professional in northeastern Pennsylvania, woman Carol Redline, who works at the Geisinger Hazelton Cancer Center. You talked just in the previous question about trying to focus on consumers. Carol's trying to focus on the cancer patients that she works with every day. There's been a new initiative to limit the amount of prescriptions that a medical assistance recipient can receive. That's impacting those cancer patients. Could you walk me through the program? I understand there's a waiver, but the frontline healthcare professionals are saying that's a very onerous process to deal with the bureaucracy in Harrisburg with the department while you're going through cancer treatments, while you're battling the disease of cancer. Is this a smart cost-saving message or measure, or is this an overreach by the department?
I think during 11-12 we implemented a provision in September to limit pharmacy prescriptions to 6 prescriptions per month for adult recipients. Although we did have exceptions to that. We had an exception for life-sustaining medications as well, too. I'm not sure which drugs fall into the cancer regime, but some of them may be included as part of the life-sustaining medications, which we exempt from the 6 prescription limit. We do also have a waiver provision. I think with everything that we implemented with the 6 prescription, we may have gotten hit with a number of exceptions during the time period in the beginning of the year. We may have been a little slow in getting back to recipients just because of the volume of calls that we were receiving. We have worked with that. We have dealt with additional staff into the call line. And then
What's the average length of time in the waiver process? Do you have?
I am not sure. I would have to get back to you.
And it's who determines the approval process in the waiver? Is that done at a regional office? Is that done through Harrisburg? Is that centralized through Harrisburg?
It's centralized through Harrisburg. We have a number of clinicians who will review the caseloads.
Well, that's something I'd like to work with the department going forward to try to streamline that process and whether there are exemptions, particularly for cancer patients.
And Senator, could we get, with your permission, her name and number so
Sure, we'll work
I
with
could
you.
contact her to listen to her concerns?
Sure, we'll
Okay.
work with you. The other question that I have, I supported Act 22 of 2011 that gave you as the DPW Secretary greater authority to root out fraud out of the system. Auditor General Wagner had put together a report noting that there's a great deal of fraud. DPW, you've been given that authority. How is it going? How much fraud have you been able to root out of the DPW system?
We have been able to root out through our quality review process. About 8 months ago or 9 months ago, we began that process. We've established a centralized Office of Program Integrity in the Secretary's office where we've consolidated the vast majority of our resources so that there is a laser-like approach to this. We have put overpayments and recoveries processes in place, quality control and case reviews. As you've seen, we've saved either hundreds of millions or through cost avoidance hundreds of millions of dollars over the past 6 months. Provider enrollment, we have a statewide provider audit that's going to be starting or has just started and will continue for the next 12 months. We have established a centralized recipient fraud unit to track all of this, and we've increased our performance measures, and our technology is starting to come into place. This is going to take a great deal of time. It's not something that can just happen in 6 or 8 months. We were focused on not just fraud, but waste and abuse. And I think that's what the legislature and the public has been looking at. And as I said earlier, waste and abuse, if you look at all of the regulations we have just put forth through Act 22, I'd say about 75% of that policy is all geared toward combating waste and abuse in the system. And indeed, fraud is a very high bar, and sometimes it takes a long time to prove fraud because you have to prosecute. And it has to go through channels, whether it's the OIG or the AG. But in terms of waste and abuse, we have done an incredible job over the past 6 or 7 months coming up with these regulations, which we just put into place, in addition to our budget initiatives to tighten up regulations and rules on providers, to enforce and sanctions across the department. And I think that's what the taxpayers are looking for. They're looking to see that the program has integrity.
Well, so you don't have a dollar amount. It's too early to put a dollar amount on what you've been able to save or in terms of fraud?
We can give you a tentative amount based on what we're saving with the Act 22 regulations and with some of the things that we've done over the past 8 or 9 months, including our quality review on cases throughout the Commonwealth. We certainly can put a number on that for you, and either through cost avoidance or through savings, it's in the hundreds of millions.